Once we have finished our daily calibration, we are now good to go and start and perform a lung function test. Now, I just want to show you quickly to go back to tools. We used to go to the calibration check. We now go to settings, and there is a whole lot of tags that is here. What is relevant for you will be your FVC report template, your information of the clinic or company, and on the second tab you will have your prediction method. There's a whole lot of options that you can choose from. For now I will use the ERS 93 Polgar. You've got your incentives, and important, you have got your printing options. Always have it in just plain black and white, and printer or PDF. In this case the printer is not connected, so I will stick with the PDF file. And once we are finished with that, we just close it there. Alright, so performing the lung function test, one will move once again back to the left hand corner top to this button here. When you hover over it with your cursor, it will show patient, and you are good to go. Now, new patient, click there, and just make it a bit easier like that. Your middle name or the patient's middle name is optional. Birth date, keep in mind it is month, date, and then year. So I will now, very important on the ID part, this is what a South African ID will look like. However, you do have the option, should the patient be an international or not a non-South African citizen, I'm just giving you an example, but always put it in, as this will make it much easier for you should a patient return and you search. I will show you the search button now. Sex, male or female, Caucasian. Yeah, they've got a whole lot of options. The ethnic correction is done automatically, so you do not have to worry about that. And all of this is extra. Do not worry about the photo part. Now, very important, before you close it, move to the left hand side in the corner where you save it. Now automatically you will see start the visit, and this page will open where you've got your patient's weight, and whether he was a smoker or not. I just want to show you if it was a smoker or a former smoker. It will give you the options of what type of tobacco or other. In this case, I will just stick with no, a non-smoker. And your session will start. Now, the moment it starts, the software will give you the command to start.
Please start force expiration and inspiration test now.
Now, just before we move on to that, I just would like to quickly pause here or keep it like that. Just moving on to the device. I have briefly mentioned the bacteria safe filter. This is a single-use filter, bacterial safe filter. Ensure that the patient takes it out him or herself, opens it. It is UV sterilized, and as mentioned, 99.99% bacterial efficient. Once it is open, the patient puts the blue safe bacterial safe filter in the device itself. Once again, very important, ensure that the adapter is on the right side. Now, moving back to the software, always make sure that your device is connected. Otherwise, it will give you a blank page and it will not work. So, once again, that's the indication that your device is connected. Now, moving back to the test.
Please start force expiration and inspiration test now.
Now, once again, make sure that the patient is comfortable. And as you can see, there is a red, yellow, and green. The moment the device or the software shows green, it shows that the patient has blown sufficient time. I will quickly show to you. Now, once you are happy with that, you go to the accept button. The software will ask, would you like to accept?
Normal, Kurt.
I will say yes. Now, as we all know, we've got at least 3 trials that needs to be done. In this case, it says here ATS, ERS, good blow, number of acceptable curves, 1 at the moment. Now, very important, do not press accept, as that will mean you have finished your session. Go to a new curve.
Please start force expiration and inspiration test now.
And once I am happy with that, I go back to accept again. Would you like to accept?
Normal, Kurt.
And as you can see, trial number 2. At the moment, I'm standing with 2 acceptable curves. and I would like to do the last one.
Please start force expiration and inspiration test now. Normal, Kurt.
As you can see, I've got 3 trials there. One can do as many as one would like. The software is designed in such a way that it will take automatically the 3 best trials. If I'm happy, in this case I am, go to accept, and your results are ready to be printed. Just going onto the device, other report result, press print report, and this is what your report will look like. You've got your patient's name and the last name, you've got the birth date, the age, the sex, the weight, the height, the BMI that is worked out automatically, the date and the time the test was performed, the ethnic group, the prediction method, and over here will be the name of the clinic or the company, your results, and then a section to say operator signature, patient signature, and very important, you've got your daily calibration test that was performed. And that concludes the information session on the DMS Spirotube. Should you need any information or further assistance, please do not hesitate to make contact with the DMS technician. As mentioned, all the information will be on the website www.dmsmet.co.za or on the protective casing that the DMS Spirotube comes in. Also on the DMS Spirotube itself, all the information for contact details to make contact with a DMS technician will be on the device itself. Thank you very much and goodbye.